My name is Gene McRae, Customer Services Director for Sandhill Center MCO. This training is to inform Sandhill Center providers of the substance abuse prevention treatment block grant funding requirements, and especially the areas found out of compliance in the spring 2016 block grant audit. The Substance Abuse Prevention and Treatment Block Grant funding is federal funding allocated to the states to serve specific populations. These funds come with requirements for any provider who receives them. If you receive any funds to serve clients with a substance abuse diagnosis, including co-occurring diagnoses, or any of the populations below, you are a recipient of substance abuse block grant funding. What are the requirements? Women's set-aside funding. In accordance with Section 1924 of Public Law 102-321, any program receiving substance abuse prevention treatment block grant set-aside funds for operating a program for treatment of women who are pregnant and who are abusing substances and women with dependent children shall treat the family as a unit, admitting both women and their children into treatment services as appropriate, and provide or arrange for the provision of the following services to pregnant women and women with dependent children, including women who are attempting to regain custody of their children. Primary medical care for women, including referral for prenatal care, and while the women are receiving such services, child care. Primary pediatric care, including immunization for their children. Gender-specific substance abuse treatment and other therapeutic interventions for women, which may address the issues of relationships, sexual and physical abuse, parenting, and child care while women are receiving these services. These requirements require the provider to either provide the services or arrange for them. If you do not provide medical care or other required services, you can refer the client to such a provider for these services. These referrals should be documented in the chart. Therapeutic interventions for children in custody of women in treatment, which may, among other things, address their developmental needs, their issues of sexual and physical abuse and neglect, and sufficient case management and transportation to ensure that women and their children have access to services provided to them, as listed in items A through D above. In accordance with Section 1927 of Public Law 102-321, any program receiving substance abuse block grant funds for substance abuse treatment shall give admission preference to those seeking treatment as follows: pregnant injecting drug users, pregnant substance abusers, injecting drug users, and all others, and publicize the availability of admission preference by the following means: street outreach programs, ongoing public service announcements, such as radio or television, regular advertisements in local, regional print media, posters placed in targeted areas, and frequent notification of availability of such treatment distributed to the network of community-based organizations, healthcare providers, and social services agencies, and in the event that the treatment facility has insufficient capacity to provide treatment services to pregnant women, refer the woman to the State Capacity Management Program. For information on the State Capacity Management Program, contact Judith Jones at this web address. If you do not have enough women to have a separate women's group, you may break out the women for special women's sessions. The requirement outlines the topics that should be addressed. It is recommended that substance abuse treatment staff attend gender-specific or gender-informed treatment training to gain knowledge and skill in these areas. Additionally, research has shown that women prefer women-led groups for their treatment. This is not a requirement, but a preferred model. For more information on the Substance Abuse Prevention Treatment Block Grant and requirements, use the following links. There's one there for samhsa.gov, and the other is for the North Carolina Department of Health and Human Services with a summary of significant federal funding requirements. For information on the State Capacity Management Program, you can contact Judith Jones at this address and ask for a weekly announcement of the bed availability. Benefit plan and enrollment. part of the admission process for clients, they are to be enrolled in a benefit plan for target population. This needs to be done carefully since the benefit plans are not the same for each target group. Please read the requirements and be sure that a client is admitted to the benefit plan that meets their criteria. It is important that members be assigned to the correct benefit plan or target population. An error in this area may lead to the member not receiving the proper treatment services or the provider not being reimbursed for services they provide. Please note the eligibility criteria for the benefit plans below. It is important that women who meet the AWSOM criteria be enrolled in that benefit plan and not in ASTER. The ASWOM benefit plan provides a wide array of services to this population. Adult Substance Abuse Treatment, Engagement, and Recovery, ASTER. This is for adults 18 or over with a primary substance use disorder covered in the benefit plan array, and who would benefit from assessment, initiation, engagement, treatment, continuity of treatment services, and/or supports for relapse prevention and recovery stability. For the ASWOM population, this is adult women who are 18 or over with a primary substance use disorder covered in the benefit plan diagnosis array, and who would benefit from assessment, initiation, engagement, treatment, continuity of treatment services, and/or supports for relapse prevention and recovery stability, and who are currently pregnant, has a dependent child or children under 18 years of age, or is seeking custody of a child less than 18 years of age. The ASWM provides a larger benefit package than the ASTER and should be the benefit plan of choice if the client meets the criteria. Referral of Work First applicants for substance abuse assessment. All Work First applicants receive a substance abuse screening as part of the application process. The audit and DAS-10 are screening tools used to determine if the applicant needs further assessment. The audit is an alcohol use screening tool, and the DAS-10 is a screening tool for other drugs. An applicant who screens positive on either the audit or DAS-10 is to be referred to the QPSA, Qualified Professional Substance Abuse, for further assessment. The QPSA will administer the SUDS for assessment and make recommendations for treatment. Documentation. The date and results of the audit DAS-10 are to be documented in the member's record. The date of the referral to the QPSA and the results of the SUDS-4 and treatment recommendations are also to be documented in the member's record. This screen shows the activities of the substance abuse professional in providing information and providing the SUDS-4 assessment to applicants who meet the criteria. Be sure to document the screening results, the QPSA assessment results, and treatment recommendations in the client record. The QPSA will provide information on substance abuse disorder and treatment if the referral is due to a positive DAS-10 screening, due to a Class H or I controlled substance felony less than 3 years old, due to a currently being in substance abuse treatment, due to a general criminal background check. The QPSA will provide assessment if the referral is due to a positive audit screen or due to an H or I felony more than 3 years ago. You have just completed the Substance Abuse Prevention Treatment Block Grant Requirement training. We hope this has been helpful for you and that if you have questions, they have been answered. You need to be aware that continued out-of-compliance issues can lead to network sanctions up to termination of your contract. Thank you.